Hello everybody, thank you students. Welcome to our presentation on the topic of clinical risk management. My name is Lucy, this is Ashley, Annabelle and Matt, and we are a group of experienced clinical nurses who now work with the National Safety and Quality Health Services to update standards and find gaps in clinical risk management. Our main role today is to discuss with you student nurses what actually is clinical risk management, where did it come from, what is its importance to nurses and fellow medical clinicians, as well as its current framework and guidelines. Clinical risk management became a compulsory principle within the quality and safety frameworks in 1995. And now Australia and New Zealand share a joint standard from the International Organisation of Standardisation, IOS 31000 on risk management. Before we jump into how we manage these risks, we need to understand what a clinical risk actually is. Clinical risks are identified through monitoring and review of incidences that have occurred within the workplace. Now, what do we even consider an incident? We have three types: an adverse event, a near miss, and a sentinel event. An adverse event is an incident that directly harms the person receiving care. A near miss is an incident that had the potential to cause harm, however, due to intervention and luck, it did not cause harm. And a sentinel event is when hospital policies and process deficiencies result in unnecessary health outcomes to the patient independent of their condition. Incidents that have been commonly identified within hospitals include falls, injuries other than falls such as pressure injuries, self-harm and burns, medication errors such as missed meds, over or under dosages, the wrong medication altogether, clinical processes such as misdiagnosis and inappropriate treatment, and even equipment faults such as infusion pumps, ECGs and bladder scanners not working. Now that we have identified the incidences that occur on a day-to-day basis, they become risks that can harm the patient throughout the duration of their stay in hospital, or even risks that can directly affect their health outcomes and treatment plans. So how do we manage these risks? What can we do to make sure that these don't happen, or at least reduce the likelihood of these incidents occurring? Are there any changes we need to make to our original policies and procedures to advance the way we monitor and manage these risks? Now, can you guys think of anything while being on placement that hospitals and nurses are involved in that we already have in place to manage clinical risks?
Fran.
Yes, Fran. Falls Risk Assessment and Management Plan to determine the likelihood of a patient to have a fall and interventions required to reduce this. Anything else?
Braden scale?
The Braden scale, yes. To determine the risk of a patient developing a pressure injury while in hospital. Even the colour-coded criteria on the observation charts that inform you of interventions and protocols to follow if the patient is showing signs of deterioration. Clinical risk management plays an important role in your responsibility as a nurse while as a student, when you're a registered nurse and hopefully working in the clinical field. It is supported through your Nursing and Midwifery Board of Australia practice standards, including Standard 1.1, complying with guidelines and standards when making decisions. 1.6 maintains accurate and comprehensive documentation of assessments and planning. 4.3, working to determine factors that could potentially affect the health and well-being of your patient. And lastly, Standard 6.6, using appropriate processes to identify and report potential and actual risk-related system issues. Our National Safety and Quality Health Service Standard 1, Governance for Safety and Quality in Health Service Organisations, was required to encompass a continuous and accountable system to improve the quality and standard of care. Clinical risk management is part of a good clinical governance system through which organisations are accountable for continuously improving the quality of care they provide. For example, Standard 1.5, establishing a risk management system to monitor patient safety. Standard 1.6, establishing a quality management system that monitors and reports on this patient safety, and Standard 1.8, adopting processes for early identification, intervention and management of patients that have an increased risk of harm. Now on to Ashley.
So I'll be addressing the question, has clinical risk management been used in other industries? Clinical risk management is everyone's responsibility. It is a process which is intended to be an integral part of any organisation's practices and can be applicable to all contexts. Risk management is used in a number of industries such as aviation, construction, financial services, government, insurance, manufacturing, food and beverage, and consulting firms. It is a routine in most industries and has been traditionally associated with decreasing litigation costs. A number of corporations implement risk management strategies in an attempt to avoid financial loss, fraud, or failure to meet production expectations. However, the success of a risk management program is dependent on developing and maintaining safe systems of care which are developed to reduce adverse events and improve human performance. Many clinics and hospital health services have well-established systems put in place, such as reporting medication errors, patient falls, routine swabs, and misidentification of patients. Every business and organisation is at risk of facing unexpected, harmful events that can result in the company losing money or cause it to permanently shut down. And risk management allows organisations to attempt to prepare for the unexpected by minimising risks and extra costs before they happen. More specifically, the aviation industry utilises risk management and has often been compared with safety in healthcare. Before safety management systems, also known as SMS, can be effectively built or improved, hazards must be first identified in your operation and ensure that there are controls in place to mitigate those risks. As SMS should be risk-based, it is an examination of what in your workplace could cause harm so you can identify if you've used enough precautions or if you should do more to mitigate the harm. Research shows that aircraft accidents not only ruin lives, but also affect airline businesses. If import is lost, assets or equipment damaged, then insurance costs increase or you must go to court. Legally, you must assess the risks to safe operations in your workplace and implement a plan to control those risks. Aviation is one of the leading industries in risk management, as most aviation industries are attributable to human factors such as faulty communication between crewmen. Pilots, just like medical physicians, are selected and are highly trained professionals. Both medical practitioners and pilots are educated for high-level performance in high-risk environments and are required to make decisions under pressure, constantly reminded by others that their mistakes can cost a life. Aviation risk management team concepts have been deemed suitable for adaptation in hospital and operating suites. Although research has found that the adaptation of the overall aviation safety concept to hospital care has previously not been correctly investigated. The fundamental principles of aviation risk management are applicable to medicine in general, and the aim of these principles is to establish a framework for preventing accidents from occurring.
So I'll be talking about clinical risk management and its relation to policies, frameworks and standards within Australia. So the WA Department of Health has various publications and policies that pertain to this issue of clinical risk management. These frameworks or policies or publications, they must all be first aligned with the International Organisation for Standardization's publication, titled ISO 31000, as mentioned by Lucy previously. This is an internationally recognised standard for all industries around the world, outlining principles and implementation of risk management within all industries. So the WA Department of Health has published its policy titled Risk Compliance and Audit, which outlines principles of risk management, including its influence on decision making, as well as actions for healthcare providers to implement in order to mitigate risk. This includes taking into account factors such as human factors and cultural factors. Furthermore, the WA Department of Health policy titled Risk Management, based on the aforementioned framework, emphasises that all healthcare professionals must act at all organisational levels to reduce risk. This policy outlines clinical governance and its role in risk management, highlighting how organisations must ensure that all frameworks implemented for this purpose includes processes to identify and classify risk. Organisations must also ensure that adequate risk identification and continuous monitoring takes place, as well as formal communication, education and training on the process of risk management to staff members. Mentioned within this policy framework is a table used to classify risk. This is a mandatory tool that must be used by all healthcare providers in the assessment and management of risks within the organisation. Titled Risk Assessments, risk assessment tables for the WA health system. This guide categorises risk according to their consequences to various organisational sectors, their likelihood to occur, their overall risk level, aggregate control and tolerance/acceptance in order to classify and therefore better manage risks with varying priorities. This table allows for a way for organisations to analyse risks that may have more dire consequences to, say, the patient or the environment and service interruption, as well as those risks that may need more regulatory action due to their increased likelihood to occur in order to better manage overall risk. The Department of Health has also published the Clinical Risk Management Guidelines. Within this document includes a vital framework in the clinical risk management process. This outlines a 5-step process in clinical risk management. These include establishing the context first, before identifying risks, analysing them, evaluating them, and finally treating them. Throughout all of these stages, communication and consultation, as well as monitoring and review, must also be carried out. Additionally, the National Safety and Quality Health Service addresses this issue of risk management through its Patient Safety and Quality System Standard, Action 1.10, which outlines what's required for organisations in effective risk management. This states that they must identify and document organisational risks, use clinical and other data to support risk assessments, act to reduce risks, as well as regularly review and act to improve the effectiveness of risk management systems. We must also report on risks to the workforce and consumers, as well as plan and manage for internal and external emergencies that may occur. This standard also provides strategies to achieve these goals within hospital, day procedure, and multi-purpose service settings. The NSQHS Clinical Governance Framework also highlights risk management as an essential component of corporate governance. It's also emphasised within this framework that it's not just the sole responsibility of governing bodies to manage risk, but of those at all organisational levels.
So why do we need clinical risk management? What's the purpose of it? In simple terms, we have it to keep our patients safe, but if we want to get technical, risk management improves the quality and safe delivery of healthcare to patients by creating systems that help clinical staff to identify potential causes of harm and introducing interventions to prevent these from occurring. It keeps healthcare organisations accountable for their role in continuously trying to improve the standard of care they provide. This is done by creating workplace environments that are aware of their responsibility to identify and manage risks as part of a good clinical governance system. But what's the point of even managing these risks? Why do we need to do this? As part of working as a healthcare employee, we always aim to do no harm, living by the ethical principle of non-maleficence, and if there are risk factors primary or secondary to the patient's reasoning for requiring healthcare, then who are we to ignore those when they have the potential to cause harm to the patient? Delivery of healthcare is complex, pressured, and demanding. So if we are able to introduce management plans such as FRAMP, or the Braden Scale, or the ADS score to assist staff in the clinical decision making and help provide safe healthcare, then why wouldn't we? Even the introduction of second checks for high-risk drugs is a risk management scheme to reduce the likelihood of the medical error from occurring. It plays an important role in keeping the patient safe to make sure they are receiving the correct medication in its route, dosage, and frequency without any adverse reactions. And it also plays a role in keeping the employee and organisation protected from investigation and financial liability. We are trying to move away from the blaming culture if an incident occurs that has caused harm to the patient and more towards why this has happened. What does the hospital have in place to ensure this doesn't happen? And if we do have a policy and procedure, is it easy to follow and identify? And if we don't, why not? This is where quality improvement projects come into play, where data is collected and reviewed from different areas in the ward and different areas of care, and it could possibly assist in the development of new risk management plans. Overall, we need clinical risk management as a process to continuously grow and develop the deliverance of our healthcare to patients to ensure the likelihood of harm from potential risk factors are reduced. We need to do this by reporting incidences, providing resources to control the risk, and recognise ways to prevent this from happening. You as student nurses, when you're registered and working in the field, and other clinicians in the workplace will have risk management embedded into your daily clinical practice. We need risk management to provide effective and efficient, safe, quality healthcare to patients.
Okay, so I'll be talking about patient safety and how that relates to quality risk management. So first of all, patient safety is defined as taking away preventable and unnecessary harm from a patient during the healthcare processes. This is achieved by healthcare staff using up-to-date knowledge and resources provided to them to ensure no harm comes to that patient. It cannot always be guaranteed that no harm will be caused during the processes of being within a healthcare facility, as many processes there will always be a level of inherent unsafety. It has come to light that adverse events occur during healthcare being complex rather than people intentionally setting out to harm others. When there are multiple clinicians caring for one patient, it can be hard to ensure patient safety. Patient safety is a major principle within the healthcare setting, and the World Health Organization recognised that there needed to be major improvement to patient safety after the institution of medicine released To Err is Human, which brought to attention the severity of medical errors within the United States, indicating there was as many as 98,000 unnecessary deaths per year. Other studies conducted suggested around 50% of harm caused to the patient was a preventable adverse event. As a response, healthcare organisations around the world designed patient safety care programs known as clinical risk management. This led to putting emphasis on certain circumstances that were most likely to increase patients' risk of harm. Errors such as medication errors, missing information during handover, and errors in infection control. As a result, 6 rights of medication, 5 moments of hand hygiene, and using Isobar format during handover were implemented. This ensured there was a path to follow when caring for patients that strongly prevented these errors. Further examples are electronic prescribing and clinicians working as a team and communicating. To improve patient safety, clinicians should be considering patient safety in every aspect of care and demonstrating their ability to provide a safe healthcare delivery. Acknowledgement of harm that can be caused by healthcare errors and learning from errors within other industries ensures the recognition that errors can happen and identifying ways in which to prevent these errors. When looking at the relation between patient safety and quality risk management, clinical risk management minimises risk by identifying what can potentially go wrong and what goes wrong during care that puts these patients at risk of harm. Assessing the causes and risks and intervening is necessary in order to reduce harm and the chances of adverse events occurring. Patient safety involves having factors such as clear policies and procedures for all healthcare workers, having healthcare professionals who are trained and skilled in all aspects of patient care, and data to drive safety improvements. Patient safety relies on quality management to identify errors and potential risks that need improvement in order to provide patients with quality healthcare that is safe. Quality risk management relies on patient safety to follow policies and procedures put into place to protect patients from harm and to report all errors or close calls in order to make changes. To Ash.
So within clinical risk management, what is the role of the nurse? Clinical risk management comes under the branch of clinical governance, which guarantees that there are systems in place within health organisations in order to maintain and improve reliability, safety and quality of healthcare. As a nurse, patient safety is our number one priority. Nurses play a pivotal role in clinical risk management and promoting patient safety within healthcare through their clinical skills, commitment to patient advocacy and strong qualifications for the risk management role. The role of a registered nurse is to be safe in their practice and is maintained through the Registered Nurses Standard for Practice, Standard 6, provides safe, appropriate and responsive quality nursing practice. Section 6.6 identifies that nurses must use the appropriate processes to identify and report potential and actual risk-related system issues and where practices may be below the expected standards. In the case that a sentinel event occurs, the incident must be reported by the nurse to the Department of Health and investigated using the cause root analysis process. A sentinel event is described as an incident when the patient is misidentified, when a surgeon leaves foreign objects within the patient, when a medication is incorrectly administered, a patient contracts a hospital-acquired infection, when a patient suicides in hospital, maternal death or serious disability with labour or delivery, or an infant is discharged wrong. Risk management nurses can redevelop the circumstances that cause the error to occur and analyse the problem whilst recommending steps which can be used to improve the procedures and decrease the likelihood of the problem reoccurring. Embedding risk management as daily operations, identifying incidents from adverse events and putting systems in place is all part of the nurse's role in clinical risk management. As shown in Figure 11, just like aviation, clinical risk can be managed by nurses using a similar 5-step process. This was also published in WA Health Policy, which Matt mentioned previously. As Matt also mentioned earlier, under the National Safety and Quality Health Service Standard Clinical Governance, which recognises patient safety and quality systems under Section 1.10 Risk Management, a nurse risk management includes reporting incidents via the Health Incident Management System, providing additional information about a risk when requested, and embedding risk management in day-to-day operations within the areas. Nurses can be active and report incidents that happen on the ward through incident management systems such as DataXpo. This is a program based on patient safety and healthcare risk management, where nurses can log near misses with patients. DataX provides clear visibility of adverse events across organisation and supports an efficient response to events. DataX also helps to ensure when changes need to be made and is then carried out quickly to mitigate the risk. Combined Hazard or Incident Reporting, also known as QIA, is another program developed to produce reports for sites that can drive performance and visibility of trends. QIA is designed to improve management and oversight of incidents. Nurses will use QIA to report when incidents such as violence, occupational risks, falls, or when needle stick injuries occur. Reporting incidents through programs such as DataXpo and QIA are just some of the ways that nurses can be active in clinical risk management.
Okay, so when looking at some relevant websites or information on our topic, the World Health Organization is a source that provides information on quality risk management. It's not only a good resource for those in nursing, but for many other health professionals. The WHO also provides links to risk websites that provide information on the topic. The Department of Health and Human Services has developed a website where they provide e-learning packages to assist in helping healthcare workers gain knowledge on the principles and processes of clinical risk management. There are many different e-learning packages that are included, such as definitions, general aims of incident reporting, case studies, human and system errors, incident analysis, and root cause analysis training. The Department of Health and Human Services also offers virtual refresher meetings, which entail repeating the material in the workshops in order to have a complete grasp on the topic. The Government of Western Australia Department of Health provides information on the quality risk management. The websites include definitions of the topic, clinical risk management processes, and resources to further your knowledge. There is also a related links section which includes information on clinical handover, high-risk medications, patient identification policies, and clinical incident management systems. Over to Matt.
Right. So in terms of risk management within clinical practice, this topic relates to all of us as nurses and as student nurses in almost all aspects of caring for our patients. It's the process of acting to reduce unnecessary harm, which is what we do on a day-to-day basis. One example that Ash mentioned of clinical risk management within clinical practice is through the use of incident reporting systems such as DataX and QIA to highlight near misses, mistakes, sentinel events, etc. that may have occurred. A 2011 study of the North East Scottish NHS facilities investigated the incidence of medication errors reported through incident reporting systems over a 3-year period. The root cause of the majority of these errors, where incidentally only 6.1% resulted in harm, was administration errors at 59%, prescribing errors at 10.8%, and dispensing errors at 9.9%. Furthermore, 80% of errors were reported by nursing and midwifery staff, with medical and dental professionals having the lowest incidence of reporting. A recent South African study investigating clinical incident reporting within critical care units found not only that incidents reported were largely hospital-related in causation rather than an error in, say, carrying out procedures or patient care, but also that a significant portion of the consequences that occurred were categorised as major to catastrophic. So there's an abundance of these studies worldwide that show that nurses have a primary responsibility for reporting not just medication errors, but all forms of risks and incidences that may occur. And through adequate reporting, analysis of the causes of these risks and incidences can be carried out, and subsequently relevant interventions can be implemented at a governance level to address, say, common mistakes in prescribing or administration errors. So this is just one example of how the concept of clinical risk management can relate to us as nurses relate to us as nurses in clinical practice and the part that we play to mitigate risks. And that's it. So thank you for coming. If anyone has any other questions. Okay, well, that's done. We'll be here for a little bit after to answer any other questions that you may have if you're too afraid to ask. But,
come on down.
Other than that,
Don't be shy. We won't bite.
Sorry.
He's staring at me.
Sorry.
That's what set me off because he was really like.
We're so
Oh
close.
my god. Yeah, I'm trying so hard not to laugh. Glass.
Sorry.